A national report about cancer says that many groups of people that have a harder time with the disease are also experiencing greater problems with COVID-19. There has been a lot of progress against cancer, but the reality is that not everyone benefits from that progress equally. Dr. Graham Kolditz is a public health expert at Washington University and participated in putting this study together. Good morning to you, Doctor.
Good morning, Randy. Great to be here.
We are pleased to have you. Well, this study found that racial and ethnic minorities are having a worse time with cancer and COVID than the general population. Why is that?
Well, that's a great question, Randy. We'd done a lot of the work on this report before COVID started and had really highlighted the excess cancer of the breast, cervix, colon, prostate in the African American community. We were ready to release and COVID hit and we turned and saw the same pattern. And this really highlights one of the issues in the report, that we need to pay more attention to the environment and social drivers that limit access to care, change the environment that people are living in, and drive up their cancer risk, but are clearly now also impacting their risk of COVID.
Yeah, health equity has been a problem, and the pandemic certainly has kind of magnified that. And we understand that Siteman has a free online tool to show us many ways that we can reduce our risk of cancer and other diseases. Do you have that site? What is it?
Sure, that's yourcancerrisk.com, and we have maintained that to be up to date and really giving helpful guidance to anyone who uses it to lower risk.
We've often known of health equity. We want to achieve health equity, but we've always known that was off balance. Do you think we're kind of turning a corner to maybe changing that?
Well, I think reports like this really draw attention to the magnitude of the problem. There's a call to action in this report for funding to understand the drivers to sustain access to care. So I think nationally we're going to pay more attention, have resources, and really understand this interplay between genetics, environment, and health services to reduce disparities.
Very important information. Thank you so much for joining us, Doctor. We really appreciate your time. And for our viewers, if you'd like to read this study, perhaps contact Siteman or get that online tool the doctor was talking about, we'll have it all for you on our website, as well as our Fox 2 mobile app. Time to take a break. We'll be right back.